So it was last week when Health Minister Dr. Joe Phaahla said that the death toll resulting from the Nehawu strike was sitting at 4 lives lost. This week, provinces like the Free State worked to get the official number of deaths as a result of the health workers' strike. But where does constitutionality fit into the debate of the right to protest against the right to the basic right to healthcare? To answer that question, we are joined by Mr. Lawson Naidoo, who is Executive Secretary of the Council for the Advancement of the South African Constitution, or CASAC. Lawson, a good morning to you. Thank you so much for giving us your time. I mean, just from a bird's eye view, looking at the situation with Nehawu and the state of our healthcare facilities at this point, is there a constitutional conundrum that we are looking at there?
Good morning, Naledi, and thank you very much. Look, I think the question has really been answered by the Labour Appeal Court yesterday. And you're correct to say there are conflicting rights: the right to strike, the right to industrial action by workers in the Constitution, as well as the right to healthcare. And these are competing rights. But I think if one looks at the legislative provisions in terms of the Labour Relations Act, which makes provision for a classification of essential workers, which is what the Nehawu workers in the healthcare sector are classified as, they are not able to take industrial action because it impacts on the fundamental right to health in the Bill of Rights. And there's the issue that has been considered by the Labour Court a week ago, as well as now by the Labour Appeal Court, which has determined that the Nehawu call for industrial action cannot include workers deemed to be essential workers, nor can it include workers who are outside of the Public Service Coordinating Bargaining Council. Nehawu seems to have accepted that in principle, but has yet to take appropriate action to inform its members, particularly those essential workers, that the strike is now deemed to be unlawful or unprotected, and they must return to work with immediate effect. So I think the Constitution and the law is clear on this issue, and has been now further clarified by the Labour Appeal Court.
Yeah, I mean, what is it exactly that we should be looking at, particularly from the Department of Health and how they handle the situation? Because they do have two responsibilities here. That is to respond to the unions, but certainly to address the issue of that basic right to healthcare, right? And how do they then start to show accountability, particularly to the public, Lawson?
Well, I think when it comes to the Department of Health, their responsibility is in relation to our healthcare facilities in the public sector. As we well know, the issue of the collective bargaining arrangements in the public service falls under the domain of the Minister of Public Service and Administration, who's a newly appointed person in that office as a result of the cabinet reshuffle just last week. So this has been an ongoing dispute since, for a couple of years now, when government implemented unilaterally a 3% increase for the public service for last year. And this matter deadlocked at the Public Service Coordinating Bargaining Council, which has led to this industrial action. So there's an issue of a political resolution to the issue of the wage demands by Nehawu. And it's quite clear that the government stance is very clear. It's been articulated by the Minister of Finance in the medium-term budget policy statement last year, as well as in the budget this year, showing how unaffordable any excessive wage demands in the public sector would be on the fiscus going forward. So I think what's really called for here is responsible political leadership, both by the trade union Nehawu, as well as by government itself. And we will recall that the position of Minister of Public Service and Administration was not filled on a permanent basis for many, many months after the departure of Ayanda Doglo last year. We had Chula Nkesi acting as minister, and we only have a permanent minister appointed a week ago. So it also demonstrates that government is also not taking this crisis as seriously as perhaps it should.
Unfortunately, though, lives have been lost. We know that the official number, according to the Minister of Health, is 4. This is while provinces continue to tally what those numbers look like, and one can only imagine what those lives, that number really could possibly look like. So once we know just how many lives really have been lost as a result of the strike, who do we point the finger at, and what kind of accountability can we get for lives lost, Lawson?
Yeah, look, I mean, and that's why, workers such as workers in the healthcare sector are deemed to be essential workers so that we don't reach a situation where lives are lost and lives are put at risk. And, one could certainly classify it, as I think the court has done, that the action taken by the Nehawu leadership as well as by its members in the healthcare sector is highly irresponsible, if not reckless, because it, can be reasonably foreseen that if those services or those services are withdrawn from hospitals, as we've seen in the clips that you showed earlier, it does place patients at a greater risk of loss of life, of further, more serious illnesses developing and the like. And this is reasonably foreseeable, and it is tantamount to reckless conduct by the leadership of the union, by the workers involved in those particular hospitals. Now, it's obviously going to be very difficult to pin a particular death on the actions of the striking workers or indeed of individual striking workers. So I think this is really a question of political accountability, political responsibility by the leadership and membership of Nehawu that has placed the lives of vulnerable people, because it's the vulnerable in our society who rely on public healthcare services and whose lives are being placed at risk.
Could we just look at the crisis that we might be looking at as we go further forward, right? Where you had at the beginning of this week, the likes of POP Crew and other unions that are under the wing of CASAC saying that they were also keen to join this strike with Nehawu. Are we seeing further constitutional crises moving forward?
Well, again, I don't think it's appropriate to define it as a constitutional crisis now, Lady. I mean, I think it's a political crisis. This is clearly the internal politics of the ANC tripartite alliance playing out here. We see splits within CASAC, with unions such as SATU having accepted government's wage offer last year. And, we've seen earlier this week SATU come out and condemn the actions of Nehawu in regard to this strike. So I think it really is it's an internal political crisis within the alliance, but it's playing out at a national level and impacting on the lives of ordinary South Africans. And that's why I say it's a question that really needs to be addressed by political leadership. As I mentioned just now, the new Minister of Public Services is very new. And I think this is an instance that requires the direct intervention of the President to try and resolve this matter within hours, if not days, because lives are being lost. It is a crisis in the public health sector. It's potentially a crisis for law and order if the police subsequently go on strike, as they have threatened to do on Friday this week.
Right.
We know that there are mass protests planned for next week, and in the absence of a police presence, one is fearful of trying to imagine what might unfold.
Yeah, very, very concerning. Lawson Naidoo there. Thank you so much for your time. We really do appreciate it. Lawson Naidoo, of course, is with the Council for the Advancement of the South African Constitution, or CASAC.